Hey everybody, and welcome back to your Design to Move series on subacromial impingement. My name is Ryan, and we've got our co-host today.
Hi everybody, I'm Ashley Laborde, Doctor of Physical Therapy. I work at Pure Strength and Pure Yoga.
And my name's Hunter Schweitz. I am a movement specialist here at Fluid Health and Fitness.
This week we're going to be targeting subacromial impingement. This is a pretty common issue. It's normally the issue that people go see a doctor like you when they have shoulder pain, right?
Sure.
So what is this? Let's give the audience a quick understanding of what's going on at the shoulder.
Yeah, so subacromial impingement, basically what it means is that under your collarbone comes up and meets up with the back side of the scapula. They form a joint, which is right above what you would think of as your shoulder joint. And what happens is underneath that there's a space where there's rotator cuff tendons and there's a bursa, a little fluid-filled sac, and those can get pinched in that space and the shoulder can become painful, especially with elevation and movements up and over the head. So that's kind of the definition of what subacromial impingement is. One simple way to assess this, and if you have it, is to simply rotate your forearm inward and then start to elevate it up towards the ceiling. You'll probably start to feel a pinch and or pain right about here, and you'll continue to feel it, and it'll stop you from moving higher than that.
All right, good. So today we're going to go over how to correct for this, going through our traditional Design to Move series. We're going to show you how to use an active release technique using a lacrosse ball. We're then going to show you how to stretch out those muscles so that we can get more range of motion. And then we're going to activate the muscles that externally rotate the arm. Once we do that, we're going to go into an integration by working the scapular depressors and retractors in coordination with external rotation. And then finally, we're going to work on scaption by drawing the arms overhead and teaching that natural scapular humeral rhythm. So that's that, guys. If you have questions, reach out to us at fluidhealthandfitness.com or Ashley at her website.
Yep, you can reach out to me at pureyoga.us, and there's a tab that says Pure Strength.
Yep, and if you like what you're hearing tonight, just know that you can subscribe to our channel, or if you want more information on the topic, we have a blog written on the subject. We'd love to have you read it and get more information. Educate yourself, get the context necessary to be more aware, and then you can be more present when you're doing your strength training or other types of training and conditioning. Let's get started.
All right.
All right.
Okay, so we're going to target the infraspinatus release using a lacrosse ball. And Ashley, tell them, where is the infraspinatus and how can we identify it so we know where to put that ball and what we're going to do here?
Yeah, okay, so I'll use my beautiful model here.
Oh, thank you.
If you're looking at the shoulder blade, just below this ridge here is where your infraspinatus lies. And it goes this way out towards, and it actually inserts on the shoulder, on the side of the shoulder itself. So when you're doing this release, you can kind of poke around and see where it's most tender on yourself. It's right on the shoulder blade, and then that's where you're going to want to have the ball working to release it.
Cool. So we're going to use the ball, and you're going to place that ball right on top of the infra and squish it basically between the scapula and the ball, and hold it there for about 30 to 60 seconds. And then once you've felt that muscle start to soften or start to feel it subside or release a little bit, then you can start taking the arm through a motion that would be the opposite action of what the infraspinatus does. So we're going to do an internal rotation and reach around the back, almost like we're trying to touch the other scapula.
Got it.
Okay, so Hunter, let's give it a shot and show them what it looks like.
Guys, I put the lacrosse ball into a sock. Otherwise, you're grabbing the ball and just trying to get it back there. So now you can just drape it right over your back.
Yeah. And this helps,
easier.
yeah, exactly. This helps to find the spot, and then so the ball doesn't keep falling. So grab a sock, pop it in there, and as you can see, he's kind of just using his body weight, and he's putting the ball right on the area, the infraspinatus muscle, and you'll feel the spot when you get back there. It's most likely going to be a little bit tender, a little bit sore, and this is okay. It's okay to, actually it's good to get in there and release something that's tight and sore. And you'll notice, keep breathing, as he's breathing into it, that muscle is actually releasing. So it's kind of like, well, it's a self-mobilization. It's a self-massage. So he's releasing his own muscle by using his body weight against the wall, the ball being the mechanism of releasing it. So we want to release it, get it back to its normal length, and get it less tense, less tight, so that then when we go to activate it, we're able to actually strengthen and get some blood flow and get some good muscle use.
So we're gonna hold it there again for 30 to 60. Now Hunter's gonna start moving his arm behind him. This is a flossing technique or a pin and stretch technique.
And as you guys might be noticing, he's having to breathe through it. So as you start to move with the ball there, it might be a little bit more uncomfortable the first few reps, but that will get better as it gets looser. This is a really good technique for most people, but if anything is really painful, acutely painful, any numbness or tingling while you're doing this technique, you want to watch for that. You also want to make sure that you're keeping good posture while you're running through the self-mobilization. And of course, if you have any inflammation or it's really acute, then I wouldn't recommend doing this.
You can go through that pin and stretch technique 3 to 6 cycles. Again, use your breath to help to relax and get the muscle to lengthen and let go. And then we would get right into our stretch.
Awesome.
Okay, let's get started. We're going to do a neuromuscular release of the infraspinatus now, which is basically a stretch that's going to take the external rotator and stretch it by internally rotating it.
The normal person should have between 70 and 90 degrees of internal rotation. Functionally, it's maybe 60 degrees, but you basically want to be in that range. And if you're not, that can really hinder a lot of things at the shoulder.
Yeah, so if that muscle's tight, and remember it attaches the arm to the shoulder blade, if I do motions where I'm drawing my arm forward across the chest, it may destabilize the scapula because it'll pull it off of its nice resting point on the rib cage.
Right.
So then that can offset, obviously, or create greater impingement or packing of that humeral head in the joint. We want to reduce that.
Yeah.
So we want to stretch it.
Cool.
So how are we going to do this, Ash?
All right, so this stretch is called the sleeper stretch. What he's doing is he's basically pinning his shoulder against the wall. He's trying to keep his shoulder blade against the wall. The arm is there wherever's comfortable range. You don't have to be super high. As you can see, he's kind of maybe like at a 45-degree angle. And then he's going to use his left arm, his left hand, to gently bring himself into internal rotation until he starts to feel a stretch. And where you might feel that stretch, you may feel it in the back of the shoulder, side of the shoulder. It should not be painful or acutely painful. So just go till you feel the beginning of a gentle stretch, and then you're going to hold it there for 30 to 60 seconds, breathing into it. Don't force it.
Yep. And so you'll notice if you pull it too far, the shoulder is going to elevate and lift internally.
Right.
We don't want to do that, so we want to make sure that it stays nice and flat. That's why we're pressing our body against the wall. We also want to be aware that if we are pushing too far, like Ashley said, that if it is compressed and inflamed, it's really going to bark at you if you go too far. So that's a good indicator of maybe this may be appropriate to refer out to someone like you if you are feeling a pressure that's too great or painful. We're going to keep that pressure on the arm for a little bit of time. And then what we can do to help to release this is go into a PNF stretch, or what's called a push-pull release, by pushing back up on the palm and flexing the muscle that we're trying to relax. Hold it there for about 6 to 10 seconds, and then relax it for 2, let the muscle recover or just basically calm down, and then see if you can increase the range of motion and get a little bit further in that internal rotation.
Yeah.
You can go through about 3 cycles of that, and you'll notice that each time you'll be able to get a little bit deeper each time. Once again, making sure that we don't go so far that you distort the joint or create pain. Get after it. You're going to do that on both sides, and then we're going to move into our activation, getting into a side lying external rotation.
Perfect.
All right.
Let's go. So to perform the activation, we're going to need to get into a side lying position. So Hunter's going to lay down on this massage table, and he's first going to start by supporting his spine by basically bracing his head in his hand. And you'll notice that his nose is basically lining up with his sternum here, or his breastbone. And he's going to keep his knees tucked in slightly into the chest so he can keep his hips in a neutral position as well. Okay, so Ashley, now that he's in this basic position, how do we work through the mechanics of the shoulder?
Yeah, and by the way, you don't need a massage table. You can lie on the floor, or you can even do this in a nice supported bed. So what we're gonna do, we're gonna take this rolled up hand towel. It's rolled up in a small ball. We're going to place it right underneath his elbow. The reason is that helps to create a better position for his rotator cuff muscles. It also helps to keep the elbow at his side when he goes into the motion. And what we want to think about up at the shoulder itself is you want to think about still keeping that shoulder blade pulled down and back. And you want to think about keeping the shoulder itself pulled into the groove where it should sit. You don't want it to come forward. So first you got to set that up before anything else. All right, here we have the elbow there. It's bent at 90 degrees, and then he's making a fist with his hand. And then from here, you're just going to squeeze back here and rotate your form up towards the ceiling, nice and slowly and controlled. Again, keeping the elbow pinned at his side.
So a lot of times we'll use compensations in this action. So you'll notice that you start bending in the elbow, and start lifting the arm off, or using muscles that we really don't want to compensate for the lack of strength in that external rotator.
Yeah.
So like Ashley said, we want to first make sure that we hold that shoulder blade down and flat against the rib cage, and try our best as we externally rotate through the arm not to rotate through the trunk and again pull that rib cage back. We want to hold the rib cage down with our abdominal pressure. Basically flex your abs, hold the ribs there, and then move through the arm. That's going to help to create a fixed position for the rib cage. It'll allow you a little more stability of the shoulder on the rib cage, and then you can go through that nice range of motion. You're going to want to do 20 repetitions of this for 2 sets. We wait between 45 seconds to a minute, and then we go right back into it. These are stabilizer muscles, so they have lots of blood flow and they can recover quickly. So if you are dealing with this, one, you don't need a lot of time to recover between the sets, and also this is something that you can do on a regular basis as long as you're not aggravating or creating more impingement in the shoulder.
If you're someone who's done this a few times and you're doing well with it, you can start to add a little bit of weight. I would recommend 1 or 2 pounds to start with, not a lot of weight, because these rotator cuff muscles are very small. So you don't want to go and add 5 or 10 pounds. That's way too much, especially if you already have shoulder symptoms. So keep it pretty light.
So once again, 2 sets of 20, you're going to hit both sides. And now we're going to integrate it into what we call a beggar's pose, which is a combination of scapular retraction and external rotation. Let's get to it. To get into this position, we want to find a corner of a wall. We're using that as basically a landmark so that you can identify how your shoulder blades lay on your rib cage and are pulled in towards the spine without them shrugging up or internally rotating. We're using this as an integration because we're combining the stability of the shoulder or the scapula with the external rotation of the arm rotating in that joint. So we want to make sure first that we can physically feel it so we can start to identify how that's supposed to feel, and we can start moving through the position. You'll notice that he has a little exercise band. This is about a 2-pound band, so there's not a ton of tension, and we don't want one that's going to be so great that the force will pull his arms off of their natural fixed position. We want to make sure that you can feel the inside ridge of your shoulder blade holding and touching in on the corners of the wall. He's going through a nice slow controlled motion, so he's rotating his arms out externally and then coming back slowly, trying his best not to let the shoulder blades rotate forward or internally as his arms come into the midline of the body. He's going to go through about 2 sets of 20 repetitions again. And as he rotates his arms back, he's breathing out to hold his rib cage down as he pulls his shoulder blades again in that fixed position and rolls his arms through that motion. So you'll notice if there's other imbalances around the pelvis, namely maybe quad dominance or overuse of the hip flexors, the pelvis will have a tendency to want to drop down. So as we try our best to keep our hips tucked under, that may pull the shoulder joint forward and actually create more dissociation over at the shoulder joint. And again, this would be another reason to visit our other Design to Move series on lower cross imbalance or quad dominance. But for now, just know that you may want to bring your legs out a little bit further to take some of the pressure off of that, so you can put the central focus on the shoulder and make sure that the shoulder blade's laying nice and flat as it should on the rib cage.
That looks awesome. He's staying really open through the front of the chest, and his head is staying in line with his body as well.
As a quick recap, we're going to want to do the position, 2 sets, 20 repetitions, nice slow controlled movements.
If for any reason you feel pain or discomfort more than your baseline during this exercise, stop, and seek some guidance as to what to do from there, because you should be able to get in this position and run through the exercise pain-free. Also, if you feel pain in any other part of the body, low back, neck, or if you can't keep a good posture standing, then that would be a reason why you would not perform this exercise.
Good. So now that we've gotten through it, let's get to our final movement. This is going to be the strength exercise. Let's get to it. We're going to perform the strength movement from a seated position. You'll notice that Hunter is sitting right on the edge of the table and he's grounding his feet down, keeping a nice neutral spinal alignment. He's going to start by making sure that his head is right up over his rib cage, just keeping his chin a little bit tucked. His gaze is fixed and forward, and he's going to make sure that the shoulder blades are glided back, posteriorly glided, and then pulled towards the middle of the spine. That's going to set him up, just like we did with the integration. And now we're going to start to challenge that position by lifting the arms up in an abducted or scapular plane motion. The arms are going to be off to the sides of the torso. If we pull the arms more towards the front, if they are still tight, it has a tendency to pull the shoulder blades off their fixed position, and that might make this more challenging.
Yeah, nice. That looks good. And as you can see, his thumbs are facing up towards the sky. That's an easier plane of motion, easier orientation of the shoulder itself. Nice and slow and controlled, and he's also keeping the shoulders away from his ears. Beautiful.
When you think about all the millions of positions that we do when we're exercising our day-to-day activities, it's important that we start to learn how to position our shoulder before we move the arm. So as usual, we're going to want to overload the muscle. This is a type 1 muscle fiber, so it responds to a lot of time under tension. So we're going to be doing 2 sets of 20 repetitions, once again, a minute in between to recover. And if you notice that at any point during that movement, you start to see a deviation from what would be the natural rhythm, again, we would look for about 2 degrees of humeral elevation to 1 degree of scapular rotation. If it goes beyond that, you're probably going to want to reduce the repetitions, minimize it down, and then start adding the volume over the course of multiple sessions. That way we can protect the shoulder and make sure that we can get stronger as our body allows for it. By getting after these techniques, it'll help to reestablish the health of the joint and lead to pain-free movement. Make sure to visit our website if you want more information. We have our blog on the series. You can read up on that at fluidhealthandfitness.com or at Ashley's website,
pureyoga.us.
Remember, your body's designed to move, so stay in motion, and we'll see you next week for another episode of Design to Move.
See you guys.
Yeah.
Bye.